Welcome to the Victory Education Lounge. As we navigate the high-stakes world of medical residency interviews together, we're tackling a crucial question today. What are your hobbies or interests outside of medicine? So, if you're ready to embark on this exciting residency interview phase of your medical career, don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of medical residency interviews and move one step closer to your residency goals. This question may seem straightforward, but there's more to it than meets the eye. Interviewers aren't just making small talk or trying to get to know you better. They're assessing key qualities that make a successful resident and ultimately a well-rounded physician. They want to see how you manage stress in a high-pressure field like medicine. They're interested in whether your hobbies demonstrate interpersonal skills, leadership, or teamwork. They're looking for signs of balance, of how you offset the rigors of your profession. They want to see passion, dedication, not just in medicine, but also in your personal interests. And they're curious about how your hobbies contribute to your personal growth. So let's dive deep into this topic and ace that interview together. Let's start with team sports like basketball or soccer. When the interviewer asks about your hobbies, this is a perfect chance to spotlight your team spirit and leadership abilities. Instead of saying simply, "I enjoy playing basketball or soccer," you can delve deeper into how these sports shape your skills and personality. You could say, "I'm an avid basketball player. This sport not only keeps me physically fit, but it also allows me to polish my team building and leadership skills." In a game of basketball, every team member has a role to play, much like in a hospital setting where effective teamwork can mean the difference between life and death. Or, if soccer is your game, you might say, "I love playing soccer. It's not just about the physical activity for me, but also the strategic thinking, the need for real-time decision-making, and the sense of camaraderie that comes with being part of a team." These are all skills that I find invaluable in the medical field. Note that, in both examples, the focus is not just on the sport itself, but on the transferable skills that you have developed from it. These skills, teamwork, leadership, decision-making, are highly valued in the medical profession. Moreover, mentioning team sports as a hobby also subtly indicates your physical fitness, which can be an asset in the demanding world of medicine. It shows that you have the stamina and resilience to cope with long hours and high-stress situations. But remember, while it's important to highlight all these positives, it's equally important to be genuine. Don't claim to love a sport you barely play. Authenticity matters. The interviewer wants to get to know the real you, not an idealized version of a residency candidate. So, if team sports are your thing, go ahead and share your passion. Talk about the thrill of the game, the camaraderie of the team, and the valuable skills you've gained from it. This shows your physical fitness, ability to work in a team, and leadership potential. For those who love the arts like painting or music, your hobbies can be a wonderful avenue to share more about who you are as a person. Artistic pursuits are not just about creating beautiful pieces or harmonious melodies. They are about expressing oneself, dealing with stress, and nurturing problem-solving skills. Think about it. When you're painting, for instance, you're not just putting brush to canvas. You're making decisions about color, form, and composition. You're solving the problem of how to best convey a particular mood or message. These skills can translate directly into the medical field, where problem-solving is a daily necessity. Consider how you might frame your response in an interview. You could say, "In my free time, I paint. It's a way for me to relax and express myself creatively, which I find enhances my problem-solving skills in clinical settings." This reveals your ability to manage stress, your creativity, and your problem-solving prowess. Or maybe music is your passion. You might say, "I play the piano to unwind. It demands discipline and practice, much like medicine. Plus, reading and interpreting music scores can be likened to deciphering patient symptoms and coming up with a diagnosis." Remember, the aim here is to let your passion shine through, while subtly highlighting the skills that make you an excellent candidate for a medical residency. It's about showing that you're not just a medical professional, but a complete individual with varied interests and abilities. And who knows, your artistic pursuits might even strike a chord with your interviewers. They may be artists themselves or simply appreciate the fact that you've cultivated a hobby that enriches your life and your practice of medicine. This reflects your creativity, stress management, and problem-solving skills. So when you find yourself faced with the question, what are your hobbies or interests outside of medicine? Embrace the opportunity to share your artistic pursuits. They're not just hobbies, they're an integral part of who you are and the kind of physician you aspire to be. Volunteering can be a great hobby to mention. It's a hobby that not only enriches your life, but also the lives of others in your community. When we talk about volunteering, we're not just referring to medical or health-related activities. It could be anything from helping out at a local food bank, mentoring young students, or even participating in community cleanup drives. Now let's talk about how to frame your answer if volunteering is your chosen hobby. The key here is to focus on the transferable skills and values you've gained and how they can enhance your capabilities as a medical professional. You might start off by saying something like, "One of my main hobbies outside of medicine is volunteering. I regularly dedicate my time at a local shelter helping with various activities." This is a good starting point, but let's delve a little deeper. What do you gain from this experience? How does it shape you as a person and a future medical professional? You could continue, "This experience keeps me grounded. It reminds me of the diverse needs in our community and the importance of empathy and understanding when dealing with individuals from all walks of life." This part of your answer highlights your empathetic nature, a crucial quality for any physician. It also points to your understanding of societal issues and the importance of community involvement. But don't stop there. Elaborate on how these experiences translate into your medical practice. You could say, "Being in such environments has taught me to listen and communicate effectively, as well as adapt to different situations. These skills are invaluable in a medical setting where every patient's case is unique." And there you have it. This approach not only showcases your hobby, but also paints a picture of a compassionate, adaptable, and community-minded individual. Remember, the goal of sharing your hobbies is to show your human side, your passions outside of medicine, and how these experiences shape you as a potential resident. This highlights empathy, community involvement, and a broader understanding of societal issues. It's about painting a holistic picture of who you are, not just as a doctor, but as a person too. If you're into adventure sports like rock climbing or hiking, then you're no stranger to the thrill of taking on challenges that push your limits. Adventure sports are not just about the adrenaline rush, they also cultivate valuable skills that can directly translate to the medical field. Imagine you're scaling a steep rock face or navigating a challenging hiking trail. These activities demand not just physical fitness, but also mental acuity, resilience, and the ability to make quick, calculated decisions under pressure. When forming your answer around this hobby, it's essential to highlight these aspects. Here's how you might frame your response. One of my favorite hobbies is engaging in adventure sports, particularly rock climbing and hiking. These activities challenge me both physically and mentally. They teach me about risk assessment, pushing past my comfort zone, and bouncing back from setbacks. Now let's relate this back to medicine. In a high-pressure environment like a hospital, particularly in fields like emergency medicine, these skills are incredibly valuable. You're constantly faced with high-stakes decisions that need to be made quickly and effectively. You could continue your answer like this. "I find that these experiences directly translate to my medical practice. Just as I assess risks and make decisions on a climbing route, I also have to make quick, informed decisions in the emergency room. The resilience I've developed through adventure sports helps me to stay calm and focused, even in high-pressure medical situations." Your interviewer will appreciate this thoughtful and insightful response. It not only demonstrates your ability to handle stress, but it also highlights your quick decision-making skills and resilience. Remember, the key here is to draw a clear connection between your hobby and the skills it has helped you develop, and then relate those skills back to your medical practice. This shows your ability to handle stress and make quick, calculated decisions. For the avid readers, you might say, "I'm a relentless seeker of knowledge. I've always found solace in the pages of a book, particularly those that delve into historical nonfiction. It's a hobby that allows me to unwind from the stresses of the day while still engaging my curiosity and thirst for learning. It's a practice that I believe is essential in medicine, a field where continual learning is not just a virtue, but a necessity." You see, reading, especially subjects beyond the realm of medicine, broadens your perspective. It introduces you to new ideas, cultures, and histories that you may not encounter in your daily practice. It enhances your ability to empathize with patients from all walks of life, making you a better, more understanding physician. Now let's talk about continuing education. It's more than just a hobby, it's a commitment to lifelong learning. In the fast-paced world of medicine, where new discoveries and advancements are made every day, it's crucial to stay updated. It's about saying, despite my years of study, I understand that there's still so much to learn. So how do you express this in an interview? You could say, apart from reading, I'm also committed to continuing education. I regularly attend seminars and workshops and even take online courses that interest me. This not only keeps me abreast of the latest developments in medicine, but it also feeds my passion for learning and growth. Remember, it's not just about showcasing your commitment to learning. It's also about demonstrating that you have interests beyond medicine that make you a well-rounded individual. It's about showing that you can balance the pressures of work with activities that enrich your life, that you have a passion for knowledge that extends beyond your professional life, and that you are continually striving to grow and improve. This indicates a commitment to lifelong learning and a well-rounded character. Remember, the key is authenticity. Being genuine is one of the most powerful ways to connect with your interviewers and leave a lasting impression. It's not about choosing the right hobby, but instead, it's about showcasing who you are beyond your medical expertise. Let's do a quick recap of what we've discussed today. If team sports is your thing, it's a great way to highlight your ability to work as part of a team, a skill that's invaluable in the medical field. It also speaks volumes about your physical fitness and potential leadership skills. For those with a creative streak, artistic pursuits like painting or playing a musical instrument can showcase your ability to think outside the box and solve problems creatively. It also underlines your stress management skills, a much-needed quality in the high-pressure medical profession. If you engage in volunteering activities, it's an excellent opportunity to highlight your empathy and understanding of the diverse needs of your community. It shows your commitment to making a positive impact, a trait that's highly valued in the medical field. Adventure sports enthusiasts, your hobby can demonstrate your ability to handle stress and make quick, calculated decisions. It's also a testament to your physical and mental resilience, crucial traits in emergency medicine. For those of you who love reading, it's a wonderful way to show your commitment to lifelong learning. It also speaks to your ability to relax and recharge, a key aspect of maintaining a healthy work-life balance. Now, as you prepare for your medical residency interview, keep these examples in mind, but remember, these are just examples. Your hobbies may be entirely different, and that's perfectly fine. The goal is not to fit into a specific mold, but to present an authentic picture of who you are. Your hobbies, whatever they may be, can offer a unique perspective and bring added value to your role as a physician. In essence, your interviewers want to know you beyond your role as a medical professional. They're interested in understanding how you manage stress, how you balance work and personal life, and what makes you tick. So when asked about your hobbies or interests outside of medicine, think of it as an opportunity to let your personality shine through. But remember, don't just list your hobbies. Explain why you enjoy them, what they mean to you, and how they contribute to your personal and professional growth. This will help your interviewers understand you better and see the value you can bring to their program. As we wrap up today's session, we hope these insights will help you ace your medical residency interview. Keep in mind that while medical knowledge is crucial, so is showing who you are as a person. So go ahead and let your authentic self shine in your interview. Before we sign off, we'd like to invite you to join our community. Subscribe to our channel for more tips like these, hit the like button if you found this video helpful, and share your thoughts in the comments section. We'd love to hear from you. Remember, the path to medical residency is not just about surviving, but thriving. And the Victory Education Lounge is here to support you every step of the way. As you embark on this exciting journey, remember that preparation is key. Take your time, be thorough, and most importantly, believe in yourself. You've come this far, and a rewarding career in medicine awaits you. Thanks for watching. Don't forget to hit the like button, subscribe for more content, and share your thoughts or questions in the comments below. Let's dive into the world of medical residency interviews and move one step closer to your residency goals. Good luck on your journey.